So ladies and gentlemen, please put your hands together. Let's give a warm welcome to the most inspiring, dynamic national healthcare, Nancy Schlitching.
Well, what a great introduction. Jeez. And I feel a little overdressed. When I saw the previous speakers, I need a very cool t-shirt. And if I had one, I'd probably, would be even better. So it is such an honor and pleasure to be with all of you today. And I want to thank Ruth Fisher, who is the Vice President of Cardiovascular Services at Henry Ford, for suggesting me to Tal and Dr. Shaw, and to them for inviting me, because this is really fun. My dad's an inventor. He has many patents, and he's 94 years old, and he has been an inspiration to me for many years in terms of the innovation space and how to particularly make large organizations feel small, feel as if they can innovate in a variety of ways and create a culture around that. I think probably many of you know Henry Ford, but one of the characteristics really of the Henry Ford health system has been innovation from our very beginning. In 1915, founded by Henry Ford, he really drove a lot of innovation in healthcare at that time, and we have been doing it ever since. We've made a number of strategic moves over the years, including having a health plan and insurance company as part of our health system, including building ambulatory sites that were comprehensive, basically hospitals without beds across the region, even in the mid-'70s, well before others had even thought about the idea. And I think one of the other aspects of innovation for all of us at Henry Ford is our unwavering commitment to Detroit, and really trying to make sure that as an anchor organization in the city, that we are a destination for patients to come from all over the world and are constantly innovating from a clinical standpoint. Some of you know I'm actually retiring at the end of this year, but I have had one of the most fascinating careers, I think, in healthcare, because I've had an opportunity to work in different markets. I've seen enormous change over the years, and it typically happens about every 15 years. But the last period of change, which we are going through right now, is probably the most dramatic. And literally everything in our healthcare space is changing. It's affecting the providers of care, our physicians and our hospitals. It's affecting payers. It's affecting the continuum of care settings and really creating different types of settings. It's affecting our employers, and probably most of all, it's affecting our patients. Because as we think about the demands on patients today who are receiving care, there are a lot of pressures. Pressures around cost, pressures around choice, how to access care effectively and efficiently, and also how to get the information that they need to make healthcare decisions. Many of our paradigms are being disrupted. Where care is provided now at the corner drugstore, virtually, and in many different ways that we are delivering care. What is being provided is changing dramatically. Much less inpatient today, trying to drive down readmission rates, less testing as we try to choose wisely and make sure that the care that is provided really does have impact on the patient's outcome. And less institutional, more home-based, more retail, more different ways that we can actually deliver the care. Who is providing it? Advanced practice providers, pharmacists, giving flu shots and doing many other things. Now in the veteran system, pharmacists are doing a lot more primary care, actually. And secondly, we're an organization that focuses on the diversity of our patient population. And clearly in today's world, we have to understand those differences in how we deliver care to each component, each population of patients that we serve. Clearly, we're also providing care through telehealth. The vital role of caregivers today is finally being recognized. And in fact, supports for caregivers is actually absolutely essential in today's complex healthcare world. The impact of technology is ever present in our world, both from a clinical and an information standpoint. And clearly, we are changing our focus from just places of care or episodes of care to the entire healthcare experience and how we connect the dots. We're also increasingly faced with the impact of high levels of government funding. We are now moving from about 50% government funding, probably up to about 70 to 80% across the country, primarily due to the expansion of Medicaid, but also the aging of the population as well. And this creates a lot of complexity in our world, a lot of complexity around compliance and other regulatory pressures. And clearly, another big change is the availability of information, the transparency of performance data today, rankings, continual evaluation of the work that we do and how we can improve it. Today, very briefly, because I don't have a lot of time, but I will try to highlight for you how to embrace these opportunities, I think, that really the future of healthcare are creating for us. How do we innovate both, maybe in more traditional innovative kind of ways, but also innovation in the community, which I think is also incredibly important. And the importance of leadership in this process, because clearly we have to create the environment for this type of innovation to happen, particularly in large organizations like Henry Ford. It's easier if you're a small, nimble organization, but when you're larger, you've got to really work at that approach. So there's 4 critical areas that I think we need to embrace as we look at these opportunities. One is becoming much more health-centric versus hospital-centric. There's no doubt that the world is shifting outside of the traditional institutions. And while we will always need some bricks and mortar to deliver care, it's clear that much of the care that we can provide does not need to be in the more traditional settings. And we need to focus on not just disease, but in fact the health experience. We also need to focus on consumerism. It's very clear that today the issues of affordability, the issues of having reliable information that people can count on as they make their healthcare decisions, on-demand access and more personalized care are really changing the marketplace. Also, the acute care versus chronic care and also the lifestyle management, much like financial managers help us with our financial management issues, we need a lot of help today to manage our own health. And we need to rethink how we actually provide care and make that team approach really partnering with patients and families. In addition, we have to have much more wellness focused. And even though the payment system hasn't quite caught up with what people actually really need, it's very clear that we need to create wellness even for patients who are sick. My mother was a dialysis patient for 3 years. She became a teacher to the nurses and technicians in the dialysis lab because she was a teacher. So she taught them what it felt like to be a patient. And it's those kind of partnership models, that type of innovation that we really need. And we also have to think more like retailers. Design the patient experience, not just allow it to occur. We need to have more brand management and also customer engagement in the process, as well as those predictive analytics that help us anticipate customer needs based on patterns of how they use the healthcare system. In terms of why it's so important in terms of innovation, it's so clear to me that when you are an innovator, you are constantly trying to think about the problem that you're solving. And often it's reframing that problem, not just thinking about it in traditional ways. And of course, most innovators don't follow any pack. They're trying to move in the other direction, which is certainly what I've tried to do in my career from a leadership standpoint. And we also have to really bring design thinking into healthcare. And Henry Ford over the last few years has had a lot of fun, a lot of excitement in our new Innovation Institute by basically bringing designers in, people that don't know healthcare, but can look at the problems that we have on a day-to-day basis, and particularly the problems that our patients have and our team members, and figure out solutions. So I want to share a few slides with you of some of the things that we've done at Henry Ford to address these types of issues. First, this is my favorite project. It's the Model G patient gown. Now you get it? Model T, Model G. Yeah, we're Henry Ford. Okay. Just wanted to make sure that was clear. But the Model G patient gown was designed by a couple of students from the College of Creative Studies in Detroit. They came over and said, "What is with these patient gowns?" And do you all love our current patient gowns? The ones that open in the back and yeah, so we decided that there had to be a better way, and clearly that's what we tried to do with this new patient gown. And I will tell you that what's particularly exciting now is that we're working with Medline to actually produce these, and they're not just at Henry Ford anymore, because in fact we're finding that there are many health systems across the country that are very interested in using this new approach. This is another very cool, kind of interesting innovation. We have these trays that are in our surgical units that include all the instrumentation. But to open them is not an easy thing, and we found that we were having a lot of injuries from nurses or technicians opening these cases. So in fact, our nurse, in addition to the designers in the Innovation Institute, basically designed this little tool that you can see there to pop the lids. And we gave them to every nurse that works in surgery at Henry Ford, and guess what? We have less injuries associated with that. Now getting more into probably the world that many of you are in, we're focused very much on digital health, ways that we can use technology to really improve the care process. This particular product is called CareTrail, and it's a patient-centered, workflow-optimized, and secure mobile communication platform that addresses the problem of allowing clinical teams to engage in real-time Twitter-like communication regarding patient conditions. So it has to be obviously very secure, but it allows that ongoing communication that does not take place in a traditional electronic medical record, but enhances the communication in terms of problem solving on a daily basis. And this is a kind of fun one too. This is called Wellsy. And this was conceived by a team that we had of Davidson Fellows for Entrepreneurs in Digital Health. And it basically allows users to connect with one another on a secure platform. And these are patients with chronic or terminal illness and those families that are looking for comfort in their shared experience. So again, very interesting ways that we can improve that care experience. This next one is called TUOP, and this is basically a digital telemedicine platform that enables patients seeking specialist options to have real-time review of radiographic images along with live discussion with providers. So it brings together the concept of working, with the images and also working with the providers. And I'm going to move along a little faster because I'm not going to go through all of these. But I do want to show you our patent wall, which is always fun. This shows the amount of intellectual property that we're creating at Henry Ford. And frankly, we had a lot of this before, but now what we're trying to do is actually commercialize and move many of these ideas into really commercial products and things that can be applied across the country. I wanted to talk a little bit, though, also about innovation in the community, because as we try in Detroit to improve neighborhoods, to improve the health outcomes of the population that we serve, we found for years we had school-based health clinics. But one of the challenges in Detroit has been the closure of so many schools. So in essence, we lost all of our health clinics the minute that these schools closed, and we made an investment. So we decided that by approaching this in partnership with the Children's Health Project and the Children's Health Fund in New York City, we now have mobile vans, and you'll be happy to know they are named Hank and Clara. We're not real creative in the name category, but in any event, these mobile health clinics go all over the city of Detroit now, visiting schools, neighborhood centers, and delivering care for young children that really need them. We also had an innovation idea a few years ago, and that was that we knew that there were a lot of at-risk young people in Detroit who might be interested in a health career. So we partnered with the Dearborn Public Schools and Henry Ford Community College, now Henry Ford College, to create an early college program from 9th grade till 1 year post-high school. And what we do is we provide education, not only the normal high school education, but an associate's degree in an allied health profession. We have 250 students in this program. We've now had, I think, 5 graduating classes. We were named the 3rd best high school in the state of Michigan in terms of our results, in terms of performance, and the 123rd best high school in the United States. So innovation can happen in a lot of different ways to address the problem of how do we get young people with a line of sight toward a really good job. And what we're finding with a lot of the young people that now have been exposed to the healthcare environment and excellent education is that now many of them are going on to 4-year colleges, are becoming nurses, PAs. They want to continue their education. So it's really having a very positive impact. Let's see. And the last 2 are initiatives that Dr. Kimberly Dawn Wisdom, who is on the right, who is our Senior Vice President for Community Partnerships and Healthcare Equity, And she's an emergency physician who many years ago learned that when you are in the ER, you see kind of the train wrecks coming in. And how do you get further up in the food chain? How do you help people with all kinds of issues earlier so you can prevent illness? And one of the things we are now working on is our faith-based initiatives out in the community, understanding how we reach people, how we partner with ministers and churches to really engage in healthy behavior discussions as well as end of life. Because one of the challenges we have around end of life is that we have different cultures, we have different religions that have different points of view. So we brought everyone together, actually in our demonstration kitchen out in West Bloomfield, and had discussion around how do we approach things in a new and creative way. And 250 ministers from all faiths came together for this discussion. And the last innovation in the community I wanted to mention is the fact that as we look at the problems of childhood obesity, Dr. Wisdom decided several years ago when she was the Michigan Surgeon General that she wanted to engage young people as partners and leaders in the community. And, you know, I always ask young people and all of our leaders when they come interview at Henry Ford one question. You know, what do you stand for as a leader? What's important to you? And for me personally, there are two words that define my leadership. One is community, and the other is diversity. And I believe my fundamental job as a leader is to create an environment for every individual to reach their full potential. That applies to our team members, our physicians. It applies to all of our patients and family members, because clearly in today's world we have a lot of opportunity to improve what we do. I also have always looked for disruptors in our organization. I think that disruptors, people that sometimes challenge the conventional wisdom or challenge the status quo, are absolutely the people that you want to stand behind and help as you move things forward. And often, you know, and I hate to say it, but our HR people look at some of these people as problem people. I always try to save the problem people, because I think that often, you know, if they didn't have passion, they didn't care, they wouldn't be pushing things so hard. So it's very important to do that, and some of my best colleagues at Henry Ford are those disruptive people that have really made a huge difference in the future of our health system. And finally, I think sometimes, you know, we get intimidated by the challenges of today's world, and we often, you know, believe that, you know, those fears are sometimes hard to overcome. I think you have to create the future you want to see. And I think that's what everyone in this room is doing as you look to solve problems, as you look to create the change that we want to see in our world. And when you do that, it is amazing what can really happen. So it's a lot of fun, and I appreciate the great entrepreneurship, the great innovation that takes place among all the organizations in this room and the individuals who are driving that. Thank you so much.